Your coronavirus questions answered live.
If you have a question for Dr. Zorba Paster, the number to call is 270-9933. And who is our first call?
Our first call is Sandy in New Glarus. Hi, Sandy. What's your question?
Hi. My question is, I've had both of the COVID-19 shots, and I didn't get a reaction from either one. Does that mean that the shot wasn't good, or I'm just okay?
No, it's absolutely great. Not everyone gets a reaction. And getting a reaction doesn't mean the shot is good. It just can be one of the side effects. But no, just like the influenza shot, lots of people don't get a reaction, and you are 95%, the chances of you're getting serious case of COVID-19 are reduced by 95% or greater once you get the shot. So the fact is you are now immune as you will ever be.
Oh, that's good. Good for you, Sandy. Let's go to Linnea in Madison. Hi there. What's your question?
Yes, my son had his first vaccine on January 30th. In 5 days after that, he was tested for COVID and came up positive. He's now since recovered, but he is scheduled for his second vaccine shot this Saturday, the 20th. Should he get the vaccine?
Absolutely, 100%. We think the vaccines should be given exactly the way they are, 21 days or 28 days, depending on whether you have the Pfizer vaccine or the Moderna vaccine. But the answer is yes.
All right, let's go to Jerry in Middleton. Hi, Jerry. What's your question?
Well, in order to visit my folks in the nursing home, excuse me, I have to have a negative COVID test. If I take the shot, am I going to show up negative or positive?
Oh, you will show up negative. The shot will not turn the nasal swab, which is what you take to see if you have COVID, will not turn it positive. Getting the shot has nothing to do with it. The negative test is to make sure that you're okay to go in there. And of course, once you're actually immunized, you still may need the negative test, but the chances, of course, are reduced by 95%.
Yeah, the shot is not a live virus.
The shot is not a live virus.
But can you test positive after you've received the vaccine?
Well, the answer is yes. We don't really know how many people, after they get the vaccine, may actually harbor COVID in their nose. We know it does happen. You're not likely to get sick. So the answer is yes. You still have to make sure you don't have COVID in your nose if that's what the rules are in the nursing home. Yes.
Got it. Okay.
The answer is you could harbor it and not get sick. And we don't know what the numbers are for that yet because we don't have enough information.
Right, and that's what our previous caller was referring to. Okay, let's go to Diane in Oregon. Hi, Diane. What's your question?
Yes, my son had COVID back in August, and he recovered. He was fine. But then months later, he got, like, something that looks like COVID toes, and he's still fine. But I'm just wondering, is that just something that could happen afterwards, or just another manifestation?
You know, if there's something abnormal and you're not sure what it is, that's when you should really call your doctor. Whatever symptoms he has may not be, quote, COVID toes. It may be something else. So this is really a video call or a direct call is really important to find out.
Yeah, we still don't know all the long-term effects of this thing.
Not at all.
All right, let's go to Tom in Jefferson. Hi, Tom.
Yes, if you get both the vaccine shots, could you still get COVID or not?
It is reduced by 95%. So the chances that you'll get it, according to clinical studies, are only one chance out of 20. So in other words, if you're in a room with anyone. Now, let me explain something else. The CDC made a change in their recommendations. They said 2 weeks after your second COVID shot, the booster, if you are in a room with somebody with COVID, you do not have to then quarantine for 5 to 10 days afterward. So they think the risk then 2 weeks after the booster shot is very, very minimal in terms of actually getting COVID. And the question that you have is a really good question. And the answer is that's why we still have to take precautions.
Okay, let's go to Dennis in Lancaster. Hi, Dennis. What's your question?
Yes, my wife had a shot yesterday, and she never got out of bed all day today. Is that worse than some other ones, or is that okay?
No, that's definitely okay, but it's probably a side effect from it. Her immune system is waking up, and as a result, she didn't get out of bed all day because she didn't feel very good. But that's okay. That means that she's actually getting an immune response. It's not a bad thing. It just means that's how her body is responding. So fluids, rest, Tylenol. If you have a fever, if you don't have a fever, you don't take Tylenol or ibuprofen, and just give it some time because that should pass.
And if you're not better in a few days, then maybe contact your doctor.
Absolutely.
All right, we are out of time. Thank you all for calling in. Zorba, thank you for your time.
Thank you, Zorba.
My
Good to
pleasure.
see you.
We'll see you next week, and we'll have a final check of your forecast coming up.